Now, the official start of the flu season is set to arrive any day now, according to federal health authorities. The latest data on influenza trends show the numbers are ticking up, and we are close to hitting the seasonal threshold. CTV's Colton Prale is standing by in Ottawa for more. Good morning, Colton. Public Health mentioned the flu season could start any day now. What's the latest data suggesting on how this flu season may be?
Actually, a little bit of good news there when it comes to the flu season. Experts thinking that this flu season will be one of the first that we've seen since the introduction of COVID that actually resembles pre-pandemic influenza seasons. There's some good news, some silver linings in that. Right now, the flu data is actually relatively normal. It's within those expected norms. It's just above the seasonal threshold of 5% positivity. Last week, it was about just over 6%. If that continues, the federal officials say that that will likely mean the start of flu season across the country. But right now, we're really only seeing widespread flu spreading in northern Alberta. Otherwise, it's localized spreading in pockets like the Golden Horseshoe in Ontario, Eastern Ontario, Quebec, Halifax. These small pockets around the country, certainly nothing like what we've seen over the past couple of years. They're also expecting it'll look very similar as far as its ramp up and scale down to what we've seen in past years. That means an early peak around mid-December before cooling off over the next several weeks. The one thing we have seen, particularly in the southern hemisphere, and they get their cold and flu season first, is that it's not just going to be cold and flu this year. RSV is going to be another concern. Their cold and flu season was particularly hard on children, and that's something that we're watching. We're already seeing it in Toronto, where RSV is on the uptick. Pediatric hospitals there saying they're seeing an increased number of children coming in. So certainly some concern there. The good news is there are new vaccines when it comes to RSV, when it comes to the flu, and when it comes to COVID-19, and medical health professionals telling people to ensure they get all of those vaccines, that they are eligible. But it also speaks to the challenges that they're facing. Dr. Colin Lee is the medical officer of health in Simcoe, Muskoka. Here's how he described what it's like as a medical professional entering this triple threat once again.
Before COVID, we call this kind of like the cold and flu season, and now it's become the cold, flu, and COVID season, really. People are just spending more time indoors. And for some reason, these viruses also survive better during the colder months. As we're spending more time indoors, we're just breathing the same airspace.
And so actually last year we saw our peak flu positivity at around 20% in mid-December. Right now we're just shy of 7%. And so there's still a long way to go, but experts actually looking this as a potential bit of silver lining. It may not be quite as bad as we've seen the last several years.
All right, CTV's Colton Prale in Ottawa. Appreciate those updates, Colton. Thank you.